Mara Beck, and this is Let's Get Talking. I'm a pediatric speech therapist, and today we are going to talk about speech and language development. Like every area of child development, there is a range of normal, and some children begin to speak later than others. Although there is a huge range of normal, some parents begin to worry when their child does not seem to be acquiring language as quickly as some of their peers. So, when should you start worrying? When determining whether your child's speech delay is something to worry about, it's important to keep several things in mind. First, how is your child's receptive language? In other words, does your child seem to understand what you are saying to her? Receptive language skills, or the understanding of language, are typically greater than expressive language skills or the use of language. When you ask your child to do something simple, does she respond appropriately and attend to the task? Observe how your child plays with other children. Is she interested in other people and toys? If someone brings a new toy for your child, does she get excited? If your child is in a toddler or preschool program, you may want to ask for feedback from her teacher as to how she's doing at school. Next, think about your child's temperament and personality. Is your child shy? Is your child a risk taker or more cautious? Many children are on par for their understanding of language, but take a little longer to express themselves verbally. This is to be expected. Also, some parents tend to anticipate their child's every need and don't give their child the opportunity to verbally ask for what they want. Some children want to make sure they will say a word correctly before they attempt to say it. Also, some children like to observe everything and will simply decide to talk when they are ready. The following are some areas that would be cause for some concern, and I would recommend seeking the help of your pediatrician and having both a full medical and speech-language evaluation. Has your child lacked smiles and sounds by about 6 months of age? Is he 9 months old and not babbling? Is he not able to follow one-step commands by 18 months old? Does he have limited eye contact? Is there excessive drooling even when your child is not teething? Does your child have a history of ear infections? Sometimes fluid in a child's ears or recurrent ear infections can delay speech. Your pediatrician may recommend that tubes be put in to drain the fluid. Is your child typically not understood by playmates or others outside the immediate family? Is your child frustrated when trying to communicate and doesn't improve over a 1 to 2 month period? Is there a delay of 1 year or more in speech language skills? Is your child losing speech? While I will be going into more detail about specific speech and language milestones in another segment, if the answer to any of these questions is yes, or your intuition is telling you that something is off, then have your child evaluated by your pediatrician, who may then refer you to a speech therapist. Upon evaluation, if everything seems typical, it will ease your mind. And if your child does, in fact, need early intervention, then you will be able to begin the process early. In my experience, and research has shown, children who receive needed therapy early tend to have the best outcomes. I'm Mara Beck, and thanks for watching.